The area of our interest is human diseases related to kidneys. This sphere of medical science is called nephrology. Finding out the reasons of renal impairment, risk diseases, complications of the chronic period, methods of replacement therapy, kidney transplantation, as well as ways of solving problems in the Russian nephrology, all of this lies in the sphere of our interest. A disease, or nephratonia, can be acute and temporary, but it can also move into chronic, irreversible phase. The medical community divides chronic renal disease into several stages according to residual function index and some other criteria. Statistically, every 10th human on Earth has some signs of chronic renal disease. The seriousness of this problem was underestimated for many years. Only in 2005, the World Health Organization acknowledged chronic renal disease as a global priority. Dialysis services all over the world experience difficulties due to the increase in the inflow of patients with terminal renal failure. The cost of treatment at this stage in Russia is about 30,000 euros per year per patient. The average number of dialysis patients being 25,000 people, the yearly cost per country is 750 million euros. Prevention of progression of chronic renal disease is an effective method of reducing state expenses on social welfare. Early diagnostics and nephroprotection face considerable challenges, including the necessity to reveal the people who are unaware of having a risk of the disease and consider themselves completely healthy. Besides, the task of early diagnosis is performed by the doctors who have not received relevant nephrological training. Other problems include the absence of structured national nephrology service capable of effective problem solving, absence of rates and standards in treatment at early stages, lack of qualified staff in regions, long distances and uneven population density, and many more. Nowadays, the flow of patients with chronic renal disease increases mostly due to a higher number of patients with the fifth terminal stage of the disease, patients requiring hemodialysis. In order to decrease this flow, it's necessary to redirect efforts to diagnosis and nephroprotection at earlier stages of the disease, which will help us slow down disease progression, lower the amount and severity of complications, and thus decrease the influx of patients requiring the hemodialysis procedure, which is expensive and burdensome for patients. This is the main purpose of our work. The analysis of the scope and our goal setting took us to developing a general structure of business processes in nephrology. From the knowledge of what we treat, we derived the knowledge of where we treat. All stages of the disease, from the GP's office at the clinic where diseases leading to chronic renal disease are diagnosed, to the departments of kidney transplantations, are considered in this structure. The next step is the development of documents regulating specific staff actions at any moment of disease progression. These are the so-called treatment process-related cards. Apart from elaborating business processes and regulating treatment documents, we have worked through a structure of administration representing the structure of the region's nephrology service. But in order to implement this structure in a certain region, one needs to know specific characteristics of this area and its population distribution. Besides that, one needs to collect morbidity statistics in the region, which can be done via collecting data from the structure primary segments into a signal registry of nephrology patients. Knowing the number and distribution of patients, one can plan competent and efficient actions to provide the population of the regions with timely medical care. Providing fast collection and transfer of data to the registry and their timely processing is possible only with the use of modern information technology. The medical information system that we have developed is equipped with the necessary network tools and automated workplaces and is capable of fulfilling this important function. The information about patients from the regions is collected into a single database on the upper level of the nephrology service structure. Having processed the data, nephrology expert committee specialists make organizational decisions concerning the service development in the regions. In addition, this single informational system contributes to the treatment process optimization. It also has certain tools for automated data collection into the system and simplifying manual data input. Tools helping physicians make the right diagnosis and prescribe an appropriate treatment program. The introduction of this automated information system into the treatment process has provided its practical efficiency. The most important positive side of this information system is its ability to solve the problem of qualified personnel shortage in the regions. Telecommunication capacities of the system make it possible to implement the idea of a virtual clinic when the shortages of qualified physicians in the regions are compensated by remote engagement of necessary specialists from the major centers into treatment procedures at the provincial clinic servicing patients from remote areas. The parent body of the nephrology service structure interacts with leading nephrologists providing remote expert help to doctors in the regions. Thus, telecommunication enables the transfer of expert knowledge to doctors from regional institutions. The statistics states that about 7.1% of population has the first stage of chronic kidney disease. While seeking for help, those people usually contact their therapists or general physicians. But nephrology is not their specialization. Our task is to help them through providing the possibility to get fast informational support. Thus, we will slow down the disease progression on lower stages. The registry of nephrology patients is formed at nephrologists' offices. A patient with suspected kidney problems is referred to the nephrologist by their area GP. The nephrologist examines the patient and, if the problems are confirmed, determines the degree of severity, stage of the disease, and enters this data into the system. From this moment on, the patient starts receiving treatment. The patient is given a personalized electronic card. All administrative and medical actions taken by the nephrology institution are tracked in the system via this card. In particular, before a scheduled hemodialysis procedure, a patient undergoes an assisted condition check consisting of filling out a form, weighing themselves, and measuring blood pressure. This card helps quickly identify the patient in the system. Unassisted performance of some simple treatment-related functions by patient make it possible to take off some load from the institution staff and free them for a more qualified work. Many routine operations of data input into the system are optimized by using barcode scanners, including the input of data regarding the supplies for hemodialysis, samples of laboratory tests, spare parts for equipment, and others, as well as tracking medical documentation, such as recommendations, prescriptions, and so on. At registration, the input of data from standard documents, like passports and insurance policies, is also facilitated by using document scanners. Other ways of data entry are also used, for instance, the voice input. Not only patients have personal electronic cards. Staff members also identify their actions in the system via their own cards. It facilitates the system use, reduces the number of routine operations, and raises the level of staff members' responsibility for the treatment and diagnostic activities performed by them. Patients are rightful users of our system, along with doctors, nurses, and engineers. A so-called patient's cabinet, a special interface, has been developed for dialysis patients undergoing the procedure. Bedside monitors allow patients to learn the details of their treatment, monitor the current dialysis procedure indicators, mark the intake of medications in the period between dialysis, receive information on the prescribed diet and regimen, and simply spend their time watching TV, movies, or studying informational materials on their disease. Patients can communicate with their physicians and complain about their condition via a video conferencing module. The interface also provides the emergency call option. In order to treat correctly, doctors need to come as close as possible to the understanding of a reason behind the disease. Analytical tools of the Maximus system can help the doctors with this. These tools include a module analyzing patient condition parameters, a module of causal relationship between nephrological-related diseases, a module called Diagnostic Machine that helps confirm initial ideas about the diagnosis and choose an effective complex of necessary additional tests, a module creating treatment recommendations in accordance with the diagnosis, all sorts of medical reference materials, and so on. Interface of the hemodialysis department doctor's cabinet has some differences related to its functionality in the department. Using the appropriate modules of Maximus, dialysis doctor is able to set prescription parameters for the hemodialysis procedure for different types of devices with the ability to choose parameters from reference books and use templates. Monitor the current parameters of the patient's condition during the HD procedure, which includes dialysis department floor plan. Control the dynamics of the parameters to the patient's HD procedures using HD procedures journaling. Assess the current state of the vascular access. Register the presence of complications and inspections of vascular access. Also, dialysis doctor needs to monitor the emergence and activity of the complications of chronic kidney disease, anemia, bone and mineral disorders, hypertension, chronic heart failure, and others. For this task, cabinet supplied with a module called Diagnostics, which helps to diagnose complications of CKD and generate recommendations for the treatment of complications. In addition, there is a separate module for registration of patients' examination results right by the patient's dialysis bed. Dialysis hall nurse is responsible for all activities that occur with the patient during the hemodialysis procedure. Registration of these activities occurs in the corresponding interface of Maximus system. The nurse can retrieve, verify, and confirm hemodialysis procedure prescription right by the patient's bed, as well as on any other terminal or mobile device. She can enter the data on the completion of scheduled medication prescriptions, on unscheduled medication administrations, on drawing laboratory samples. The registration of used medications and consumables is performed using a barcoding system. Nurse is able to control significant parameters of the current procedures and any possible complications in patients in the department floor plan visualization module. Moreover, monitoring of the patient's condition may be performed by a nurse by monitoring video feed from the patient's dialysis bed. Nurse receives emergency calls and requests from patients, as well as alarms from the dialysis machines, along with tips on how to resolve alarms in accordance with regulations. Nurse is able to perform the screening of vascular access by patient's bed, which allows the nurse to access its condition, to register problems found using the interface, and determine the need for examination of the patient by the physician. Also, the interface of the nurse's cabinet has the option to control temperature and humidity in the dialysis rooms. Conditionally, engineer's cabinet can be divided into two parts: water treatment interface and the dialysis machine's interface. Since the quality of the hemodialysis procedure not least dependent on the quality of water treatment, much attention is paid to dialysis department's water treatment system parameters control. Maximus engineering interface allows you to monitor the main parameters of the water treatment process in real time. It issues the alarm and fault messages when deviation of key water quality parameters and status of water treatment plants from normal state is detected, shows the history of alarm and fault conditions, helps to perform planning and results recording of water laboratory analysis, helps to control scheduled maintenance of water treatment system, keeps a log of routine maintenance. Hemodialysis machine's engineer's interface allows to track the record of the machine with respect to fixing fails, machine maintenance, parts replacement, etc. Intelligent troubleshooting knowledge base helps to speed up repairs and get the equipment online, and failure statistics module allows to plan in advance the purchase of necessary spare parts and consumables. A laboratory assistant's cabinet and a laboratory assistant physician's cabinet. The duties of a laboratory assistant are to conduct laboratory studies and register their fulfillment. Therefore, a laboratory assistant's interface has the following features: automating the process of carrying out laboratory research through the use of barcodes. For this purpose, barcode formation and printing subsystem is created to print barcodes on test tubes by a designated laboratory studies. Automatic transfer of study results from analyzers and manual registration of study results. Logging laboratory studies using status models of the laboratory sample movements. Monitoring of laboratory complexes maintenance. Tracking the working time of the equipment, which allows to determine the real service time of the equipment and its current state. Binding a performed laboratory studies to the hemodialysis procedures. Logging laboratory studies. Formation and print report documentation by assigned, conducted, and overdue laboratory studies. The duties of the laboratory assistant physician are to control the fulfillment of laboratory studies, and Maximus interface matches their functionality. It incorporates the following features: laboratory studies planner that works in accordance with the rules of studies conduct and has the function of setting custom laboratory complexes. Automated quality control of laboratory studies in accordance with the electronic database of reference values. Tracking of supplies and reagents availability in stock. A component called Green Corridor that allows to control parameter changing dynamics of laboratory studies in tabular and graphical form by plotting all the parameters of the study. Documentation report creation and printing module that allows printing reports by assigned, conducted, and overdue laboratory studies. Due to the lack of qualified nephrology specialists in the regions, we have developed a system of remote control and management of the treatment process and all the complementary processes taking place at a remote dialysis department. Parameters of each patient's procedure, as well as images from CCTV cameras, are transferred to a large regional center where experienced physicians control the process via large monitors. If any problems arise, they can instantly interfere and, using telecommunication functions of the system, give instructions on correcting the situation. The system features a notification module aimed at instant reaction to emergency situations. If any parameter of any process controlled by the system exceeds the norm, it creates an event that can be set for the automatic messaging to the people responsible for this process. The messages can be sent to mobile phones as text SMS directly to the monitor of the staff member on duty, as emails, etc. A video conferencing module built in the Maximus system enables to conduct remote consultations next to the patient's bed. An expert from a remote nephrology center can view a patient via a camera built into the bedside monitor, ask questions about the patient's condition, run a remote examination, and give recommendations to the patient's physician on the choice of an appropriate treatment strategy. A more detailed analysis of difficult clinical cases takes place in a form of teleconferences involving patients, physicians, and remote experts. Audiences from other regional departments of the structure can connect to the conference for educational purposes. The telecommunication functions of the system allow the country's key specialists to deliver distant lectures. This contributes to regional staff professional growth. Nefrosovet suggests the use of its Maximus system at the initial stage of medical care, in the polyclinic, taking the quality of medical care to a higher level. Anyone would visit a polyclinic after the first disease symptoms appear. However, before visiting a physician, the patient should register the visit. At this point, the Maximus system comes into play and simplifies the maintenance of necessary records for the staff. The process of identification of a patient and the reasons for their visit is automated as much as possible by using document scanning functions, voice input, etc. Upon completion of the required registration stage, the patient is issued an electronic ID and verbal instructions on their further actions. At this point, the patient might be advised to fill out a questionnaire, or undergo standard laboratory tests. If these procedures are not required, the patient is referred to the general practitioner. With their electronic ID card, the patient proceeds to a survey terminal and specifies the symptoms of their disease by answering simple questions. The answers are recorded by the system, analyzed, and at the end of the survey, the system can give the patient the instructions on further actions. After the survey, the patient looks at the special EQ panel and goes to the room of their attending internist. Before the consultation with a doctor, the patient interacts with the nurse, who performs such standard procedures as blood pressure and body temperature measurements and prepares the patient for the doctor's examination. Acquired data is entered into the Maximus system by the nurse. The task of internist or general practitioner is to primarily identify the disease. To do this, clinical laboratory tests are usually performed. Judging by the primary symptoms and test results, the doctor makes the decision on the initiation of a medical therapy or referral to a specialist. At this stage, Maximus gives the internist primary information support for diagnosing and proposed action plan when specific symptoms of the disease emerge. The internist can be assisted not only by the system, but also via a consultation of a specialist using telecommunication connection to a specialized call center. If the internist decides that the disease severity requires particular treatment, they refer the patient to a relevant specialist and record this action in the Maximus system. In intensive care units, treatment is organized according to the organ classes. Thus, a lot of software and hardware facilities have been developed to maintain and monitor the parameters of all vital systems, i.e., heart rate monitors, ALV machines, etc. The module of the Maximus system operating in the intensive care unit analyzes patients' EHR, collects the data from the equipment, displays the latter in the sequence at different monitors, and automatically forms the recommendations for emergency physicians on the basis of the treatment standards depending on different syndromes. We widely use telecommunication technologies in the surgery units. In particular, video from a camera mounted on lighting in an operational room enables following the surgeon's action by the staff involved, remote experts, and trainees. At the current stage of technology development, it becomes possible to make specialized aid immediately available to those who need it. It's a noticeable step forward in the prophylaxis and prevention of different diseases. The teledoctor system organized in Nefrosovet allows each internet user to get an initial consultation of the experienced professional regarding their present symptoms. Qualified healthcare specialists give advice via a video connection on what to do if any health issues occur, where and which examinations should be performed, where to seek initial care. Patients with a long history of disease are provided with recommendations on the improvement of their condition.